Yes, it's an unexpected thing, isn't it? You don't. I never planned for a catastrophic event like that because I don't have cancer in my family.
Mm-hmm.
I don't think about it.
Right.
And I think it's, yes, you save money for retirement. You want to be able to retire comfortably. So you save your money or you sell your business, you put your money, you invest your money. So make it, build on that. But no one thinks of catastrophic
Mm.
savings. What if
Right.
it's not just you? What if it's your husband, your child, your mother, your father? That needs the help. You don't plan for that. And I wish.
Hey, Joanna, how are you?
I'm good. How are you?
I am doing well. I am sorry, I just sent you a text asking if you were going to be joining me. Oh,
It's
that's
a.
a picture behind you.
Oh yeah. Well, I can change that. I was in a meeting this morning.
Got
Uh,
it. Who is that behind you? Who's that picture of?
it's a little. It's a produce gal, who grows on the tower gardens and hydroponically. She's got quite a little business going on. So I was talking about growing food at your back door in your garden.
Mhm.
Easy peasy, hydroponically.
Yes,
Yeah.
hydroponically. That's
Mm.
pretty cool. So, do you do that yourself?
I do. I have two towers myself.
Got
Yeah.
it. And what sorts of things do you grow?
Okay, I have lemon spinach. I have cilantro, different lettuces, snap peas, growing um, collard greens. What else am I growing right now? Hmm, um, different types of greens. Right now, winter is nothing but greens. And in the
Okay,
summer, you have your fruit, your tomatoes, cucumbers, peppers, that kind of thing. So I
got it.
can grow everything from broccolini to collard greens, Swiss chard, spinach, all of that.
Got it. Did that come as a result of really trying to be more mindful of what you're eating after the cancer?
Yeah, it's easy. I can just go on my back door and pick what I want because I eat greens every single day.
Okay.
If I put them in my smoothie or I prepare them in salads or to go with other dishes. I can go and pick what I want. So I'm not wasting anything. I just pick what I'm going to eat that day. So it's great. I'm hooked. I'm totally hooked. Yeah.
Got it. Got it. Well, thank you very much for joining me, and thank you very much for saying yes to potentially being a guest. Um, I'm always looking for guests. I'm always looking for people who can speak to what I call the 5Ds. And I was just looking at kind of some of the people that I've had on the show in the past. I don't, there haven't been that many people who were affected by a disease that were on the show. So when I met you and saw and heard you talk about what you talked about in the meeting, I was just like, she'd probably be a really great guest. So thank you.
Yeah, you're welcome. I'm happy to speak in regards to anything related to helping people understand what it takes.
Got it. Got it.
Takes a
So
village for
it
sure.
does take a village. And I apologize. My co-host was going to be on and her phone, she also does Medicaid,
Oh,
helps people with Medicaid, and we are in Medicaid season. So she looked at her calendar and it was empty, and then her phone started ringing. So she wasn't able to join us, but she would definitely be able to join us
sure.
when we actually do the podcast. So, do you have any particular questions or what
When you,
what?
yeah, sorry about that. When you say Medicaid, I really, there's definitely a need for that in regards to people who've been diagnosed with cancer that have no insurance. I would be happy to hook her up with Yoli Argol, who is the founder of Cancer Kinship. It's a mentoring program for cancer patients. A lot of cancer patients do not have insurance, so she's scrambling to get them on Medicaid. Um, Scrambling. So it's always good to find someone that actually does it, because most insurance brokers do Medicare or you know health insurance, medical insurance of different from different companies. So it's, like I said, it is hard to find, and there's definitely a need with that for people struggling with cancer. They don't have insurance.
Yeah.
Some Quite a few.
So I'm sorry, I misspoke. I did not mean Medicaid.
Okay.
It's Medicare season. So
Medicare.
it's Medicare season, and so she's involved with that right
Okay.
now. Yeah. So
Yeah.
yeah, that would be interesting to find somebody who's specialized in helping people get Medicaid who don't have that. Start looking for that
Yeah.
because it sounds like there's a big need for that.
Yes, there is. Yes. Be great.
So, this meeting is really about just kind of getting to know each other, talking through kind of the logistics, dynamics of what it is, the podcast is, and all of those things. Did you have any questions that you wanted to ask?
I've been invited to speak on different podcasts, and I don't really have any questions. I'm sure you have questions for me, but I think there, and why I responded to you really was because out of pocket expenses for people dealing with a life-threatening disease can be horrendous.
Yeah.
There are some treatments out there that only pay about 80%.
Mm-hmm.
And that said, specifically men with prostate cancer, if they go to like a proton therapy treatment, it only pays for 80%.
Mm-hmm.
Other traditional type of treatments, whether you're going through stem cell transplant program or infusions, the medicine that you have to take and to build your white blood cells or whatever it is very expensive,
Mm-hmm.
very expensive. And while I was going through stem cell transplant, which actually I didn't go through the program because during that whole period and the type of procedures, myself and several other people were infected with hepatitis B.
Mm-hmm.
So they put me, I mean, my liver enzymes was off the charts. So they put me on a medication that cost $900 a month.
Wow. Wow.
So, and that's just one story. There are other stories, there are other medications that cancer patients have to take,
Okay.
whether it's, prednisone or to build your white blood cells or plasma injections or whatever it is, that is very, very costly. And if you have that kind of money in the bank where you could just, most people don't, they don't
Right.
have that kind of money, and they have to borrow from family members, they have to borrow from friends to pay those costs that were unexpected costs. So, and the thing that happens too is that it increases their stress level. It's not
Yeah.
just a financial situation. It is a, a life-threatening situation. It's an emotional situation because they don't know where they're going to get the money. They don't know how they're going to do it, and so it elevates their stress level, which also is going against what the treatment is trying to do, is kill cancer cells, right?
Right.
So, and that's why I think it's important for me as a cancer health coach to talk about all those issues with people out there that are listening. They just need to prepare for that. Because as you know, cancer is increasing,
Right.
exponentially. We used to know someone, right?
Right.
And it was always a distance. It was far from us, far removed from us. Now it's,
Right.
a friend, or your family member, or yeah, everybody know, everyone is close to you. People that are close to you that have been diagnosed with cancer.
Yeah.
And it's not just cancer. You're talking about autoimmune disease, autoimmune, and a lot of autoimmune diseases. You have to be on certain infusions, you have to take certain medications, and some of them are very, very costly, depending on the
Hmm.
autoimmune. And a lot of autoimmune diseases are precursors to cancer. So,
Anything you wish you had done that would have made that season of your life less challenging in terms of finances? Let's put it that way.
yes, it's an unexpected thing, isn't it? You don't. I never planned for a catastrophic event like that because I don't have cancer in my family.
Hmm.
I don't think about it.
Right.
And I think it's, yes, you save money for retirement. You want to be able to retire comfortably. So you save your money, or you sell your business, you put your money, you invest your money. So make it, build on that. But no one thinks of catastrophic
Mm.
savings. What if
Right.
it's not just you? What if it's your husband, your child, your mother, your father, that needs the help? You don't plan for that. And I wish that I had, really. I didn't want it to come out of my retirement account,
Hmm.
pay for those. And I didn't want to do that because I wanted that to be, I'm still working. I'm 77 years old. I'm still working. And I
Okay.
enjoy working, which is a good thing. And I can work, which
Yeah.
is also a good thing. I'm able to
Right.
work.
Right.
But if you're not able to work, then what? I wished I had sort of set aside something, an investment, or some kind of savings, or something that was specifically for a catastrophic event, whether it's for me or for my husband or any family member. And I
Got
keep
it.
telling my children now to always have a plan B. You always have a plan B. Plan A's are simple, they're easy. You live to do this, and you make the money, you pay your bills and everything. But plan B is what most people don't think about. And I'm one of those.
Got it. I don't know. As I said, it's kind of a strange thing because most people don't want to think that they're going to be the ones. They always think that it's always going to be over there, these other people. And I love that fact that you're talking about is no matter where you are, having a plan B is always a good idea because even if you don't use it for plan B for you, you might end up using plan B for your spouse, you might use it for your children, you might use it to supplement your retirement. So the plan B money is always going to be helpful no matter what circumstance.
I agree. Yeah.
Yeah. Right. So, and then we have one kind of strange question I would always ask. It's not a strange question, but it's just a fun question that we throw on the end, which is, and you don't have to answer the question now, but I want you to be thinking about it in terms of what is the song that is the soundtrack for this season of your life?
Oh,
Yeah.
interesting. That is an
Yeah.
interesting question. What is the song?
Yeah, so again, you don't have to answer it. It's one of the questions that we ask, but it's not a question that people would have prepared for if I didn't tell them it was coming.
Hmm. Interesting. Okay. Okay.
We often will also ask questions. So we don't have so I don't usually send the questions in advance because I want to have a dialogue between me and you. But we often will ask if a question that's along the lines of if you could go back and talk to a young Joanna, what would you tell her? And you might say something about like your plan B type of thing, or there might be another thing that you want to talk about. But I think that you are bringing up um, important things for people who aren't planning for Plan B that they need to be thinking about, even if it's for themselves. I just had the opportunity to talk with a young lady that I'm working with who I ended up talking to her about getting some life insurance on her daughter, who is now a year old. And it just turns out that she was diagnosed with autism. So she's on the autism spectrum. So the fact that she already has it means that she'll be able to keep it for the rest of her life. But if she didn't, at age 1, she would be oftentimes kicked out of the pool and wouldn't ever be able to get life insurance ever again. So it's just those sorts of things that kind of come up.
Yeah, there is.
So in terms of it, we record on Fridays is typically when we record. If you haven't put your picture and a little bio in the Google Drive in the Google Sheet that we have requested, that would be important. As I said, we'll record. In terms of when is it going to be announced, I've just hired a new virtual assistant, so she's in charge of getting the ones that I've already recorded from when it was just me out over the next couple of weeks. And then I'm anticipating that whatever we record would not be released until 2025. Once I've talked to her on Monday, I'll have a better idea of what's the timing, because I was going to have her do it a week at a time, but I think I'm going to have her do like 2 a week so that I can blow through them so that I can start the new season out the way that I intend to start it in early 2025 rather than pushing it out until like March or something.
Okay. Yeah.
So I think that it. Oh, it's a Zoom interview. So so just know that probably what I'm wearing would probably not be how I would show up that
Sure.
day.
Sure. Yeah.
Yeah, and then I've got my virtual assistant. It lives on YouTube, and then in addition to that, she will put it out. She'll strip all the audio off, and she'll put it out on all of the audio only places that you can put podcasts.
Yeah. It's interesting because I'm counseling a woman right now, and she's got stage 4, and
Mm,
uh, she's it's a kind of a critical stage. She's a psychotherapist, and she's a director of a rehab center and working a lot while she is going through treatment
Mm-hmm.
because she doesn't have the finances is to pay for everything that she needs to pay. Not only that, she is working a lot to give something or to have something for her children, to have something left for her children
Right.
in case she doesn't make it through. So she's planning, but see, the people wait until, and that's the thing, that is really the thing. You have something like that happen, and then you're scrambling around to trying to figure out and balance everything. You do, and you can't. And I get where she is now, and I'm trying to
Right.
help her and support her and everything, and try to keep her stress level down. But she's scrambling to do this, to pay for everything, to pay for her mortgage, to pay for all the treatment, to leave some money left over for her daughters, you know.
Right.
So this is who we are. This is who we are as cancer patients, and some of the things that we have to deal with. And finances, our financial situation is huge. It's
Yeah.
huge. Yeah.
Yeah. Yeah. It's oftentimes one of those things that we think we can kick down the can and you'll get around to it eventually. And maybe you will. But if cancer catches you before that, then you're in the situation you were just talking about, which is scrambling, trying to deal with what you didn't plan for. For those people who don't have a plan B, they're just scrambling in order to do it. And what I've read about cancer or catastrophic illnesses is the stress that you're under can be really overwhelming, and that's not good for it really messes with the medical outcomes that you're trying to get.
Yes. And there are some treatments available for
Mm-hmm.
people,
Mm-hmm.
very, very good treatments
Mm-hmm.
that are not paid by the insurance company. They're not covered by the insurance. There's a specific blood work specifically to detect cancer cells in your body.
Right.
That's $4,000 out of pocket.
Wow. Wow.
And to talk to, let's say, an integrative oncologist is integrative Western and Eastern philosophy or treatment, which is great because sometimes traditional Western medicine can't help you. Consultation for the doctor is $4,000 out of pocket.
Yeah.
Yeah. So you can see how you can dive into your savings and dive into your whatever it is, and long-term care doesn't cover all that, doesn't cover that, and AFLAC doesn't cover that, and none of that covers that. You have to have what I call a catastrophic savings account or some kind of investment that can help you through it.
Absolutely. You do. All right. Well, I think that gives you a sense of it. So what I'll do is I'll send you a link to the I will send you a link to the next thing, which is to actually record the podcast. And what I would say to you is Mandy is slammed until after, I think, December the 2nd. I think that's when she says she's free again. So I'm asking that you consider looking for a date after December 2nd in
Okay.
order to find when you're looking for a time for us to do the interview.
Okay.
Yeah, so that would be terrific.
Okay.
Any other questions? Anything else?
No, not really. I'm I'm good.
I think you really brought up an important topic that as you said, not a lot of people have given a lot of thought to. And I think it's a really key and critical because this series and this topic is really just I've seen the impact in my client base of people who didn't have a plan B, and it can be devastating. And what one of the things that you really brought out inside of this conversation is the plan B money would be used for your spouse. Because I've seen a lot of people spend down a lot of their wealth taking care of their husbands, and then their wives are really just, and then their husbands pass away, and now they have significantly less, and they're really trying to make it on significantly less than they had and what they thought they were going to have in retirement. So it really
Or
can have a
debt.
huge impact. Debt,
Or
yeah,
debt.
yeah.
Mm-hmm.
I think those two things are really important. And that's really the things that I would like you to kind of highlight in your interview with us. I think they're important topics and something that people need to start thinking about. And, my thing, oftentimes people always want to wait until they get a ton of money, but it's kind of like, with investments or any type of thing, if you just put some money aside, you will at least have that pot of money, even if it's not as much as you want it, but it will give you a little bit of relief in the interim if you don't win the lottery.
Yeah, right. Right. Well, there's two types of prevention, right? People, I talk about prevention in the health, what if? What makes you
Right.
think? What makes you think you're not going to come down with something? Prevention. Do
Yeah.
something for your body. Do something
Yeah.
long term for your body. And there's prevention on the other end. There's prevention if something does happen. So, yeah,
Yeah. I think that would be important to talk about the two types of prevention.
yeah. I'm going to be speaking on that women's group the first Tuesday when we get back. I think it's the first Tuesday of December at the Hera Hub. Your
Oh,
office, your office is there, right? Is it? Okay.
yep. Yep. So
Yes.
unfortunately, I'm going to miss that because I will be in Scottsdale. But yeah, I'm going to miss that. But I'll have you on my podcast, and you'll talk about it. You can talk about some of the things that you share on my podcast.
Okay. Sounds good.
All right. Well, thank you very much for your time. I really do appreciate it.
Absolutely. Yeah.
All right.
Thank
Have a
you.
great one.
Take
All
care.
right. Bye.
Happy Thanksgiving. Okay.
Happy
Bye.
Thanksgiving.